We are in March. March is Colon Cancer Awareness Month, and there is a lot of myth about colorectal cancer. The reality is that these myths are not true. I am Dr. Yadira Borrero Vaz, a specialist in gastroenterology. Let's talk about it.
There's a myth that colorectal cancer only affects elder persons. Is this true?
No, this is not true. Colorectal cancer don't discriminate. It affects younger and older people, male and female. In the last 20 years, we have been seeing a significant increase of incidence of colon cancer in people under 50 years old.
Some people say that once you have colorectal cancer, you will die.
That is not true. Colorectal cancer is a curable disease. Over 90% of the patients who are diagnosed of colorectal cancer in early stage are cured. Unfortunately, the only 40% are identified in early stage.
Persons say that they don't have colorectal cancer because they're eating right, practicing exercise, and don't have any symptoms.
That is not true. Colorectal cancer is the third most common cancer overall in Jamaica, and it is the third leading cause of cancer-related death in this country. Sometimes don't cause any symptoms or signs. For that reason, it's so important the colonoscopy for colorectal cancer screening starting at age 45. But if you have personal or family history of colon polyps, colorectal cancer, or medical conditions such as inflammatory bowel disease, or if you are a woman and has history of breast cancer or uterus or ovarian cancer, you should start at earlier age.
There is a myth that says once a family member doesn't have colorectal cancer, I will not have it.
That is not true. More than 70% of the patients diagnosed of colorectal cancer, they don't have family history of colorectal cancer.
Persons say that once you have a polyp, it means you have colorectal cancer.
That is not true. A polyp is a precancerous growth found in your colon or rectum. If you leave it, the polyp may turn into a colorectal cancer. But the good news is that most of the polyps are small and can be removed during the colonoscopy, which is the gold standard for colorectal cancer screening, because it's the only method that allows the entire visualization of the colon and the immediate removal of precancerous polyps in a single procedure. If you are over 45 years old and have some of the symptoms, rectal bleeding, change in bowel habits, low blood count, unexplained weight loss, or has personal history or family history of colon polyp, colorectal cancer, or inflammatory bowel disease, you should get a screen for colorectal cancer. Remember that healthy gut, happy life.